Welcome to this month's edition of ASNAHA Fireside Chat. We are now about midway through summer and hopefully midway through this pandemic. Can't thank ASNAHA members enough for their commitment to providing a high level of quality care, especially during these times. Here are your current updates. EPDPA. Access is going to pay out $4.60 per hour of paid claims from October, November, and December of 2019. These funds are to be paid to EPD providers by mid to late August. $20 million in total is being distributed to EPD all-text providers, not just non-medical, but all EPD providers. Communications. ASNAHA has been sharing our COVID member list with all the local hospital systems, including Honor, Banner, and Mayo. The list being shared is a complete member list with those marked who can provide COVID care. The hospitals have been extremely grateful to ASNAHA in sharing this resource. ASNAHA is also supporting a donation drive to help the Hopi Nation in receiving much needed supplies. Here is that flyer. Member benefits. Next week, July 27th to 31st, ASNAHA is providing a benefit to all ASNAHA members to get COVID tests at no cost. ACOS will be administering these tests at selected locations throughout the Valley. We hope all of those who are interested in taking advantage of this benefit will have the opportunity to do so. Here is that flyer. Conference. We have sent out our virtual conference series lineup to all members. This is a free conference series to all members. All of the presentations this year will focus on different aspects of COVID and how it has and will be affecting our businesses and approaches to care. Our first presentation is next week, Wednesday, July 29th, and presented by Paychex. We also want to thank our sponsor, SanData, for supporting ASNAHA and this conference series. Here is that schedule. As many of you are aware, your board has 2 strategic sessions a year, one in January and one mid-year to check our progress and keep our focus. This year, COVID derailed many of our initial plans, but with the help of our members and our board leadership, we've been able to pivot quickly and effectively to refocus our efforts on more pressing issues. First, a list of our accomplishments. Collaboration. EPDPA and ASNAHA have built a solid working foundation between the 2 associations through the leadership of ASNAHA board member Aaron Sinekin. ASNAHA and HCOA work together to promote members and our industry heroes. All 3 organizations have pooled resources to elevate all members. Communication. We've established these fireside chats to keep you, our members, up to date. Conference. We've collaborated with national and local leaders and created a virtual conference series to make sure that we are able to still bring important and relevant industry content to our members. COVID. We've moved quickly to get proper resources, education, and information to members as efficiently as possible. EPDPA. We have thrown our support behind EPDPA and our all-text members to secure much-needed reimbursements to continue to provide much-needed care. Now, an update on what we are focusing on for the rest of this year. Communication. We will continue to communicate as much as we can with members and healthcare professionals on what ASNAHA is doing for COVID response and care, including a focus on the increased awareness of the immense value of in-home care to help mitigate exposure to infectious disease. Membership. We're going to increase our efforts to boost membership and the value of our association, especially during this pandemic. We're going to utilize technology and our resources to expand reach into areas outside of Phoenix. We also plan on a biannual membership value survey. Stay tuned for your first survey to be distributed at the end of this year. EPDPA. COVID has put a wrench in the successes of reimbursement negotiations. ASNAHA plans to fully support EPDPA in any of their efforts to get these rates increased as necessary. Board members. We will be looking for industry leaders to join our already amazing board, specifically those interested in executive leadership. We ask and welcome ASNAHA members who are interested to please apply. Once again, I want to thank all the members for their continued support and for the opportunity to serve you and our industry at large. If you have any questions or concerns, please do not hesitate to reach out to us at any time. Thank you, and in good health, ASNAHA.